Part two. So, let me introduce myself just slightly more, just for a couple things. First of all, my interest in medicine in World War I started when I began writing novels about World War I and wanted to have an angle that very few other writers have, which is medical. So one thing I do know is medical. And as I dug into the medical history of World War I, but more specifically the 4th Brigade and the medics and the docs who were working with the troops, I began to find really fascinating stories. So they became the basis for a novel that is called Our Desperate Hour, a novel of Battle of Belleau Wood, and then another one called An American Nurse in Paris, which are both works in progress but substantially done. In any case, so I've kind of given you the broad outlines of what was going on in medicine during that time and some of the limitations that doctors and nurses were working under. No antibiotics, no IVs to speak of, transfusions, very difficult and high risk. Coming out of an era in the 1800s when traumatic amputations were commonplace, the old sawbone idea of the doctor literally sawing people's bones, limb preservation and saving lives were both very big priorities, and the question was how to do it, how to accomplish this. So let me step back a little bit and tell you a little bit about the organization of medical services during World War I on the American side. Steve told you about the Square Division and how divisions were organized. There was a medical organization as well. Beginning at the bottom, in the field you had corpsmen and medics who would tend to the wounded at the scene. And then litter bearers or stretcher bearers who would try to get those people back to an aid station. Typically the first aid station you got to was a company aid station. And about all that happened at the company aid station was that a pharmacist mate, and I'll just talk about Marines now for a minute, a pharmacist mate would tend to the wounded and try to get them back to a battalion aid station, where they would do a little bit of stuff, but no surgery, nothing serious. The battalion aid station would then evacuate you to the ambulance dressing station, which was the farthest forward position you could bring an ambulance without it getting blown up reliably. From an ambulance dressing station, you were then taken to a field hospital or a regimental aid station, depending on your wound. From there, you would be evacuated to an evacuation hospital, which is further back, where emergency surgery would be done. And from the evacuation hospital back to a base hospital. So digging into these just a little bit more. Everybody here who's a Marine knows this already, but the Marines don't have doctors, they don't have medics, they don't have corpsmen. So all the medicine for the Marines is provided by the Navy. And this was done to a certain amount of resentment by the United States Army, who really didn't think the Navy had any reason to be on the ground. So the inter-service rivalry that existed between Marines and Army during that time also to a certain extent existed between Army and Navy medicine. Navy medicine notably was not included virtually anywhere in the history of the medical side of the war that the Army wrote. So the ranks are a little bit misleading, just like Navy ranks often are. So the lowest ranks in the hospital corpsmen were hospital assistant 1 and 2, and then you had a pharmacist's mate 1, 2, and 3, and then a chief pharmacist's mate. But none of these people were pharmacists. They were all medics, basically. So think of them all as just being the different ranks of medics or corpsmen. In the field, you would have usually a hospital assistant or a pharmacist's mate running around with each company, or attached to each company, providing immediate medical care. They had dressings, they had iodine, they had, they didn't really have good tape, by the way. We didn't use tape in World War I, it hadn't been invented yet. So they didn't have tape, they didn't have Band-Aids. For medicine, they carried morphine. It came in 15 milligram unit doses that were called Greeley units. And so the guys in the field had some Greeley units, a bunch of bandages, and some iodine that they could paint a wound with, and that was about it. At the company dressing station, if you had a broken bone, they could splint it. If you were bleeding badly, they could put a tourniquet on or try to stop the bleeding, but they didn't keep you at a company aid station very long, because these things were just in a shell hole or a gully, very exposed. They tried to put them in protected areas, but there were no protected areas to be gotten. The battalion aid station was the first place where you would see a doctor. The doctors in the battalion aid stations were within pistol range of the Germans. There were many casualties among Navy physicians in these battalion aid stations. It was not uncommon for them to be blown up multiple times, and it's actually amazing that more of the doctors weren't killed than were. Battalion aid station was not a place where you did anything fancy. It was pure meatball surgery, if there was any surgery at all. From there, you moved back to a field hospital that might be somewhat in artillery range, because it was a little safer. Only emergency surgery again, occasionally a transfusion, no IVs. From the field hospital, if you were serious enough, they took you to an evacuation hospital that was out of artillery range. And there you might have surgery if it was life-saving. But the really fancy surgery, a lot of the surgery was done at base hospitals, which were located many, many miles beyond the front. The problem for the medical people at Belleau Wood was that there were 2 American base hospitals in France at the time. They were both Navy base hospitals, one in Saint-Nazaire and the other maybe Brest, I think. There were no Army base hospitals. All the Army base hospitals being built in France at the time were being built in Lorraine, because that's where the Army was going to be. So there were no base hospitals anywhere near Belleau Wood. This led to a big dilemma. Pershing had banned American use of hospitals in Paris because it was nowhere near where the U.S. Army was going to be operating. And they were crowded, a lot of traffic. Getting in and out of Paris was slow. And but when Belleau Wood lit up, a lot of finagling was done to open up American Red Cross military hospitals in Paris. Ultimately, there were 5. The largest one was in Neuilly-sur-Seine, which is in the northwest side of Paris. If you think about the Paris and the suburbs as a clock, it was about the 10 o'clock position in Paris. So then getting into Belleau Wood, I described how when the Marines and Army began their rush to the Chateau Thierry sector, there were 24 ambulances total in a division of 28,000 troops. Medical supplies no more than what you could cram into those ambulances. Medics and doctors on the Army side, corpsmen and doctors on the Navy, Marine side, rushing around, completely disorganized, trying to figure out where they were going to work. And at the same time, the French forbade them from having hospitals. The front was moving so quickly that the French figured that within 2 weeks Paris would fall, and so they did not allow hospitals to be built between Belleau Wood, Chateau Thierry, and Paris. They told the Americans, don't put any hospitals there because they're just going to get captured. The problem is, it takes a while to get from Belleau Wood to Paris. In fact, the evacuation times took as much as 48 hours over congested, bad roads. The French did not allow the Americans to use any hospital trains, which were a fairly routine way of evacuating troops from the war zones. But the French had the train lines all tied up, and the train lines were all devoted to bringing bullets and munitions and troops to the front. They didn't really care about getting the medical, the injured back to Paris. So the American medical people involved in this battle were in a real pickle. The French weren't letting them build hospitals. They weren't allowing them into buildings to use as hospitals, and yet they had to. And so ultimately they ended up doing what Americans do a lot. We just simply lied and told them, oh, we're just going to set up a little triage over here. That happens to be an evacuation hospital with 1,000 beds. But we won't tell you about those beds until they're built, and the whole concept of begging for forgiveness rather than permission became very much a way that medicine was done in this battle. So, drilling it down to what did a Marine experience? If you were wounded in the field, you had your hospital corpsman hopefully find you, and for a while they were sticking the gun's bayonet first into the ground, so that the litter bearers could find you and get you out of there. When they realized the Germans were using that as an aiming point, they quit doing that. It was very hard in a field of wheat to find some of these guys. The corpsmen in the field would try to stop your bleeding and get you the heck out of there. That was about all they did. They started a wound card. They would put a card on you, start a little wound card, and hope that the litter bearers were not all wounded and get you out. These guys were literally carrying people in litters across machine gun swept fields, and the casualty rate among the corpsmen and among the litter bearers was extreme. Most of them ended up casualties. Once you got to the company aid station, they got you out of there as quick as you could because those were typically under fire. Battalion aid stations were frequently under fire and moved frequently because of literally artillery strikes. One of the innovations was a thing called the Thomas traction splint. The machine guns, the Germans were very diabolical, as everybody else in this war was. This was not strictly a German thing. They set the machine guns at leg height. So the idea was that they were not going to shoot you in the head. They were not going to shoot you in the chest or the abdomen with a machine gun. Not directly. What they were going to do is shoot out your leg, and as you're falling, then you fall through the machine gun fire and get your chest and abdominal fatal wound. But even if they didn't give you a fatal wound, it was great, because if they blew your leg out and you couldn't walk anymore, number one, you were not effective, and number two, it took about 4 guys to get you out of the field in addition to the corpsmen. So you had to have 4 litter bearers. That meant you took guns out of guys' hands and gave them a litter. And so it was a great way, from their perspective, to reduce the effectiveness of the infantry. If you got shot in the leg and you broke your shin bone or your thigh bone, these things are incredibly painful. They're also incredibly traumatic to the tissue. The death rate from a thigh bone fracture in 1910 was 80%. So 8 out of 10 died from that because of bleeding, infection, and shock from blood loss and pain. A British guy developed a splint in the 1880s, a fellow named Thomas, that would put traction on the leg and bring the edges of the bone apart from one another. The traction splint reduced thigh bone fatalities down to 8%, so it was a dramatic change. And since these leg wounds, the leg fractures were very, very common, the use of the Thomas traction splint was a huge innovation in this war. And if you go around to EMS services worldwide now, you'll see variations on the Thomas traction splint still in use. So if we have somebody with a femoral or a thigh bone fracture today, we treat them with a traction splint using the same principles that were used in World War I. Another problem was gas. Gas was used a lot. Now, the Americans were told back in the States, in the press and during training, gas was no big deal. They use a little bit of that over there, but don't worry about it. A lot of American troops just didn't get it, that gas could kill, that this was really bad stuff. But again, the Brits knew it, the French knew it, the Germans knew it, and they were all lying to us. The Brits and the French were minimizing it a lot because they were so desperate to get Americans in here, and if they were truthful about gas warfare, a lot of American mothers and fathers would go, no, I'm not going to send my son over for that. On the German side, the kinds of gas that were used in bellow wood very liberally were mustard gas and diphosgene. Mustard gas is not a gas, it's an oil. It's an oily compound that creates a mist that attaches to everything it touches. It just sticks to it. Imagine somebody just spraying Pam in the air and try to walk through that Pam spray and not get covered. You will. You will. And so mustard gas, which was also called Eperite, also called Yellow Cross. The Germans put 2 yellow crosses on their mustard shells. Mustard was used extensively during bellow wood. And it was very deadly. You get it on you and it burns your skin. You breathe it in, it burns your lungs. You get it in your eyes and you're blind. Sometimes the blindness was permanent, usually it was temporary, but it was completely disabling. And when it disabled you, it required help. So again, you tie up other troops evacuating wounded, gassed victims. So gas was used a lot, basically whenever the wind was favorable, and so there were certain days when the gas was used a lot. They gassed the aid station in Lucy as frequently as they could. They bathed Lucy in gas. And when we go through Lucy Le Bocage, you'll see why and where it is. The biggest gas attack in bellow wood was on the evening of the 13th-14th when the Germans came up with a particularly creative artillery barrage, which was more or less almost equal amounts of high explosive shrapnel and gas. At that time, this was right after a time when the guys at the northern part of the wood, 2-5 really needed reinforcement, and 2-6 was going to go in and reinforce them. And about half of 2-6 was located in a wood south of bellow wood. Their movement there had been observed by balloon observers, and before they could move out, the Germans bathed them in artillery and just gassed them all. Gas casualties that evening were about 900 at least. It was a huge disaster. The relief of 2-5 was more or less eliminated by this gas attack. Only a few guys got through. So gas was a big problem. What you had to do with gas was, first of all,
Go ahead and wrap it up in a second.
okay, what you had to do with gas is get it off of you, don't breathe it in, and wash out eyes. And I'm not going to bore you with degassing because that's a whole other talk. But anyway, gas was a very big deal here.